This Health in Focus is a paid segment by Jagannathan Neurosurgery.
Today we're talking back pain, specifically lumbar stenosis. We have board-certified neurosurgeon Dr. J. Jagannathan here with us. So from people that are suffering with back pain, what do they really need to know? What is lumbar stenosis?
So lumbar stenosis is a term that generally indicates that there's narrowing around the spine. Lower in lumbar means lumbar spine, so it's in the lower back. And those are the nerves that travel down the legs. So a lot of times patients, when they have that, will complain of leg pain, shooting pains, what's known as sciatic pain, which is pain involving the sciatic nerve. In other cases, depending on the degree of degeneration or damage to the disc, or abnormal movement of the spine, they can also have significant back pain. So the lumbar stenosis just is a generic term for narrowing, but it can manifest itself in several ways.
And for people that are watching, what are some signs and symptoms in specific they should look out for? Is it really just back pain in general?
No, I think back pain is fairly common, and most back pain is actually self-limiting, meaning it gets better on its own. It's pain that doesn't get better in spite of what you call conservative or non-surgical treatments like therapy and observation. It's pain that radiates down the legs. It's problems with weakness, problems with bowel and bladder. I mean, those are generally red flags, and certainly any kind of pain that doesn't improve is usually something to be concerned about. It's usually normal aches and pains usually do get better as time goes by.
And how are you able to help people when they're dealing with lumbar stenosis?
There are a variety of methods. I mean, we always start conservatively, meaning non-surgically, as I'm sure Mr. Ames can attest to, and then the treatments kind of progress from there. I mean, things like interventional steroid injections are oftentimes used. Physical therapy is an extremely important part, and then when those don't work, there are surgical options, including minimally invasive approaches, where we can go in and clean out around nerves and help restore the alignment of the spine.
Yeah, and we do have Tom here with us. You were suffering for some pretty significant back pain before you came and saw Dr. Jagannathan.
Yes.
What were you dealing with?
I had bilateral thigh pain was my big issue. That was the major cause for coming to see the doc.
Yeah, and how was that impacting your life?
It was, well, I couldn't walk very far at all without having to stop and take a break.
Yeah.
And that wasn't my lifestyle, that's all.
Yeah, that's a big hindrance to
Yes,
anyone's lifestyle. How was Dr. Jagannathan able to help you? Because you're standing and walking around pretty good today.
Well, I am. I'm still in the period of recovery, though. So, yes, I can go farther almost every day, which is a bonus.
Yeah.
I can attest to that.
Yeah. Dr. Jagannathan, how are you able to help Tom out?
I think every treatment kind of involves specific approaches depending on what the MRI shows and what somebody, the status, how someone's feeling before surgery. So in cases where, the arthritis is long-standing, a lot of times, some of these minimally invasive techniques we use to really clean out around the nerves and to hopefully provide more room for them. And then there is the recovery period is always a phased period where we start slow and kind of work your way up. A lot of times leg pain in terms of reliability is something patients notice a difference on fairly quickly. Anytime you have surgery, there's always some back pain in the beginning, but that usually gets better with with time and with healing and stuff like that. But usually I think the advantage of the minimally invasive approach is that it allows us to do surgery on maybe patients who may not have been candidates previously as well.
Yeah. Well, I'm so glad you're starting to feel better. Thank you so much for coming in and talking with us. Dr. Jagannathan, thank you. If you want to learn more about Jagannathan Neurosurgery, we've got all the details for you on 9and10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.